Hello, my name is Lily Correa. I'm a registered dietitian and director of education and training in the Office of Nutrition and Lifestyle Medicine at NYC Health and Hospitals. And I'm very excited to partner with Loved One today to bring you this webinar entitled Embracing Cultura y Satisfacción, Practical Nutrition Strategies for Hispanic and Latino Health. Now, this is a subject that is very close to my heart, so I am really excited to be able to talk to you about the culture that I grew up in and that I'm always so excited to work with and serve. Our learning objectives today are explaining the role of satiety and satisfaction in regulating hunger, supporting healthy eating behaviors, reducing chronic disease risk among Hispanic and Latino populations. We're going to identify traditional nutrient-dense foods like avocados and describe their evidence-based impact on satiety, diet quality, and cardiometabolic health. And we're going to explain how mindful eating can be used as a powerful tool to enhance satiety and satisfaction. And we'll apply culturally relevant strategies for meal planning, for counseling, to integrate satiety-focused eating patterns into real-life Hispanic and Latino food traditions. Now, over the next few minutes, I'm going to walk you through a mindful eating exercise. So if you'd like to participate, please grab a beverage or snack for the exercise. Let's start with what is mindful eating. It's really about being fully present with your delicious plate of food in front of you, right? Being in that present moment. And when it comes to eating specifically, we're talking about savoring every bite. Now, in our lifestyle medicine programs, this lovely child here has become the face of mindful eating because, as you can see from his expression, he is savoring every bite. And at this age of discovery, right, there's so much more newness, so different flavors, colors, textures, right? There's so much more time. Now, maybe this child actually gets to sit and enjoy his food because he has that gift of time. Remember when summer break from school felt like it lasted forever? And now a month feels like it goes by in a single day. There's never enough hours to get everything that we need to do done. So we tend to go a mile a minute. Well, today we're going to slow down and transform how we approach nourishment. So I'm going to invite you to take a slow and deep breath and let yourself arrive right here, right now. Feel your body supported wherever you're sitting, your feet connected to the ground. Allow yourself to be present and breathe naturally. Today, I'd like to explore mindful eating with you as a profound act of self-care and as a way to get more in touch with your feelings of hunger and satisfaction. So imagine the food or drink in front of you, not as a task to check off the list, but as a profound act of love for your body through providing nourishment. Practicing mindful eating encourages us to fully engage with our food without any judgment and with a relaxed mind. Mindful eating exercises help us to stay present in the moment by observing and enjoying our food with all of our senses: sight, touch, smell, taste, and sound. Now, choose a piece of food or your drink. And before you take a bite or a sip, look closely at your food or drink. Notice the texture, notice the color. Does it feel cool or warm in your hand? Notice how your body feels. Are you genuinely hungry? Genuinely curious? Not judgmental? Close your eyes gently if that feels natural, or lower your eyes. And before taking a bite or a sip, explore the food's smell. and really take it in. Now take that bite or that sip. Chew the piece of food slowly, focusing on your chewing and tasting senses. Bring your attention to the texture of the food as you chew. And if you're sipping, push the liquid around your mouth. If you're chewing, chew deliberately. Notice the flavor sensations. Is there a change in flavor or temperature as you chew? Now pay attention to the sensation of swallowing. Food or drink, and does it go down smoothly? As you continue to enjoy the food or the drink, remember, food is not just fuel, it's information, it's connection, nourishment. Remember, mindful eating is about allowing your attention, your thoughts, your emotions to let you be fully present with the food experience. And as we close, I invite you to carry this gentle curiosity into your next meal. Eat like you're savoring the moment, because you are. And if you've closed your eyes, I invite you to open them again. Welcome back, and thank you for practicing mindful eating with me. Now, this is an exercise that is very popular that we take our patients through in class. Because we know that in our fast-paced world, we've really lost the art and opportunity to take our time and savor every bite, which not only promotes a healthy relationship with food, but also influences our ability to feel full and satisfied, which has implications, of course, for our long-term health. So many households, including Hispanic and Latino families, are at risk of losing their tradition of having meals together due to the fast-paced living, having different schedules, working two jobs, and even the independent nature of North American society. So food represents a strong symbolic component in the Latino communities. It brings connections to our roots, cultural heritage, and identity. And family mealtime brings a sense of togetherness because it cues that importance of family. So a large body of research has demonstrated the benefits of eating meals together. And when we think of interventions for a patient of Hispanic Latino origin, we'll definitely want to keep the familia and the importance of meal times in mind. But want to explore more about how mindful eating interventions like the one we just experienced can be particularly helpful for this population. And as you saw, it can be applied to food only. It can be applied to drinks, right? It can be, you can try to incorporate both, but they can be really helpful. Now, we know that Hispanic and Latino communities experience a disproportionate burden of lifestyle-related chronic diseases. With diabetes, for example, we have a higher rate of diagnosis compared to total adult population. With CVD, we have a growing burden among the young population. In obesity, a higher prevalence compared to total US population, including children. And metabolic dysfunction-associated fatty liver disease, or MAFLD, is one that's not talked about as much as the big three listed above, but it certainly is a topic of conversation in family circles and communities. Hígado graso, or fatty liver, is something that really comes up in conversations because a lot of people have it. And so it is like a table talk type of conversation, or can be. So of course, while MAFLD does occur in people of all races and ethnicities, it's very common among Hispanic individuals. The prevalence is 23 to 37% of the Hispanic population. And the prevalence might be even higher among certain subgroups like Mexican Americans at 54%, compared to 14 to 29% of the white population and 13 to 24% of Black population. Now, the good news is that the same plant-based eating patterns that are recommended in lifestyle medicine to reduce the risk of, to manage and improve outcomes related to chronic diseases are also recommended for MAFLD. And what's great is that if patients adhere to this higher fiber eating pattern, short-term results can be seen as quickly as 8 to 12 weeks. So reduced liver fat, improved metabolic markers, ALT, AST. And I had this experience with a family member. I had to have her replace butter with avocado for a morning toast, for example, and have her do oatmeal and fruits with nuts with soy milk every morning. And consistently, she did this. And just a couple of months later, her levels had been about 3 times higher than they were supposed to be. And just a couple of months later, following this eating pattern, she went back to the doctor for labs and they were all normalized. Now, such a quick turnaround can be very motivating for patients to continue to adhere to our nutrition recommendations. So, interestingly, as we look at the recommendations, we also see healthy home-based eating environment where time is shared with family and friends, right? Among all of the other recommendations that we know, decrease high sugar beverages, right? Those beneficial fats, higher in plant-based proteins, for example. So that really is cool because that recommendation of eating those home-cooked family-based meals really goes along with the cultural traditions of Hispanic and Latino families. So it goes right along with that. And speaking of nutritional recommendations, embracing cultura or culture is a part of our talk today. So it's crucial to consider when making dietary recommendations because fostering cultural inclusion in our clinical settings really calls us to move beyond simple awareness to actively embrace and celebrate our differences. So this means recognizing, honoring, and valuing every individual's unique culture, background, and traditions around food choices and the reasons behind them. So in healthcare, a commitment to cultural inclusion empowers our patients to feel truly welcomed, supported, and confident in sharing their authentic selves. Now, in the Latino culture, we certainly cherish the experience of cooking, the connection to our culture and heritage, and the sense of tradition that it brings. It's just a central part of life. Recipes are passed down from generations to generations, and cooking and feeding the family is how we show love, right? And there's just this facility in talking through recipes and variations of common preparations. These are all common topics of conversations. For example, I can get on the phone with my grandma and she tells me she saw this show with this recipe, and she's talking me through it and then she's talking to me how she made it and the different ingredients that she used because she didn't have that. And you can make it this way, and you can use this ingredient with that, and it's going to taste like this. And it's just, I'm always in awe of how easily she can talk through a recipe and knows exactly what to do without having a book in front of her. So that is something that I find common amongst members of her generation or my mom's generation, for example. And of course, we have a lot of celebrations that center around food. So we're talking about food constantly. We're celebrating around food constantly. Now, many of our cherished dishes are centered on meat and dairy. And this is an important point to consider because we definitely take a lot of pride in our cultural dishes, right? So telling us to change or leave out an ingredient or maybe change the preparation method, if we pose it the wrong way, it can sometimes be perceived as offensive, right? Like if we tell patients to stop eating tortillas or don't use oil or just substitute kale instead, if it's unfamiliar to us, right? Now, I know that as clinicians, our default is to be prescriptive, right? We see a problem, we want to tell the patient what to do to fix it. But in lifestyle medicine practice, we really have this great opportunity to flip that script and use a descriptive approach instead, one that focuses on a patient's experience, context, and beliefs, right? That patient-centered counseling. So oftentimes I also hear my patients saying that they have this ansiedad para comer at night. This ansiedad or anxiety, this urgency to eat, can be tied to more than just physical hunger. It's worth exploring how familismo plays a role. Now, familismo is a core cultural value that entails connectedness, dedication, commitment, and loyalty to family. It also involves seeking family for advice and support. So, extensive research shows Hispanics have a strong commitment towards the collective over the individual. La familia es todo, is everything. So, have to make them proud. And while familismo can be a positive thing, it can also at times coincide with a high stigma against mental health issues. You don't need a therapist if you have the familia or el padre, right? The priest. You need to make the family proud at all costs. So if something's wrong, maybe you're going to keep that quiet. You're going to keep that to yourself. And so patients may be reluctant to discuss feelings of anxiety or depression and may use eating to cope instead. Now, there's common stressors, which include acculturated stress, the stress that comes with adapting to a new culture, including weight stigma, body image tied to more westernized standards, for example. Like when I was growing up in Peru, it was a common belief that larger bodies were healthier. If you were too thin, estás enfermo, or you were sick, right? But nowadays, Western standards of beauty reign, so thin is in. Now, this thinking can sometimes create a generational clash, but it can also bring a lot of feelings of moral failings or guilt over not being able to lose weight. It becomes a lack of willpower conversation, and there's just a lot going on with that, all of that thinking. But cultural context is important, right? Having this background is important to think about when we're helping patients navigate nutrition recommendations. So identifying potential challenges that can help us see opportunities for addressing gaps in our own knowledge and in the patients, which help guide our recommendations. Now, when recommending a plant-based eating pattern, some common barriers that we hear a lot are, my family doesn't want to eat what I eat, right? I don't know what to eat. Or another common one, I don't get full on a plant-based eating pattern. I get hungry quickly. Now, sometimes with this last one, people have the idea that eating plant-based means eating a salad or just vegetables, vegetales, right? So they might remove the chicken on the plate and just leave the rice and veggies. And guess what happens about an hour later, maybe less? They're going to be starving, right? Now, this is one of the reasons why we teach people how to build a balanced plate. It's not just for nourishment. A balance of protein, whole grains, non-starchy vegetables, and healthy fats drive that fullness and satisfaction through key nutrients on the plate, preferred foods, different textures, right? All of the components of the plate matter. And our patients need to know which plant proteins to replace a piece of chicken with. So this is the plate visual that we use in our program. The one on the left is our original plate that we started with, our first version, back all the way back in 2019. And on the right-hand side is the one that we use today. So we started featuring a piece of grilled tofu on our plant-powered plate because visually and in the experience of eating the plate on the left, even though it looks good and beans are a great source of protein, our patients reported that it felt like something was missing from the plate, right? So for example, here's where on top of all of this stuff that you see on the plate there, maybe a piece of chicken is there, a piece of fish or something like that, right? So we started replacing with a piece of grilled tofu and the beans, right? And quinoa and the vegetables, etc., and the healthy fats. So we also replace the tahini dressing on the left-hand side with an avocado as the healthy fat. And this is a food that is, of course, culturally relevant across various culinary traditions, certainly across all Hispanic and Latino populations consuming avocados. So now we'll get more into how the nutrients in these foods, protein, fat, and fiber, as well as the presence of traditional preferred foods, all impact satiety. But first, I want to get into a little bit more of the physiological and psychological processes that are going on in our bodies as well when we eat. So two terms that are used in the literature and when talking about the body's processes for managing appetite our body's overarching desire to eat, are satiety and satisfaction. And satiation. So satiation is the feeling of satisfaction that signals eating to stop. I've had enough here. And we feel satisfied and don't feel we need to eat anything else at the meal or snack. Now, this process of satiation is influenced by meal composition. For example, high fiber meals are particularly great at promoting satiation because they're going to take up more room in our stomach, slow digestion, and feedback cues to create the satiation response. Whereas satiety is the feeling of fullness that persists after eating. Think of this as the period in which you stay full until hunger returns. Now, if you have a high protein, high fiber breakfast, you're going to get a higher satiety response than if you just had a sugary latte for breakfast. This may seem nuanced, but why it matters for our conversation today is that different factors drive satiation versus satiety. And while meal composition, meal quality are critical, there are more physiological and psychological drivers at play. So appetite, satiation, and satiety, they're all fascinating topics. They're all interconnected. Appetite can be discussed as this biopsychological phenomenon because it's not only influenced by internal factors like regulatory hormones, but by external factors like the sight and smell of food, cultural traditions around food, and emotions. For example, I mentioned in Hispanic and Latino cultures that food is central to let's all of our celebrations. I was going to say many, but let's be real, all of our celebrations, right? It brings comforts and feelings of nostalgia. So this emotional layer as we engage in the food celebration can actually override our biological cues that are telling us that we're full. So as we start to look at all of this fascinating complexity, it really puts into perspective where all of these moral failings, conversations about food and weight belong. And we don't control as much as we think we may do, right? Now, the satiety cascade here is a nice visual of the pathway to satiation and satiety. It's initially affected by sensory and cognitive factors, including expectations about what we're about to eat, the taste, the texture, and the smell of food, and any associations with previous experience that arise. Your emotional state, what the food looks like, the size of the plate you're having it on, the time of day you're having it in, the presence of others around you as you're eating it. These pre-ingestive factors, these sensory cognitive cues that we receive about the food we're about to eat can actually impact how satisfied we end up being with the food. That's pretty phenomenal. Now, once the food or drink reaches the stomach, post-ingestive factors start to take effect. So the stomach distends due to the increase in volume, which sends a signal to the brain and initiates satiation. Then, once the food is absorbed, certain nutrients are detected by the receptors in various sites of the body, including the brain, providing information about energy status that affects satiety. So what's really cool about the satiety cascade is just seeing how all of these signals, cognitive, sensory, physiological, how they combine to regulate appetite. Of course, not all foods generate the same satiety response, unsurprisingly, which is where we can find opportunities to talk with patients about balance and composition and quality of meals. So more on that later. Now, we started to look at the many factors involved in satiation and satisfaction on the left-hand side here. Let's get into satiety a little bit more. So several gut hormones work together to regulate our appetite. They send signals to our brain when we're full or hungry, right? Some examples are GLP-1, leptin, ghrelin, and certain nutrients, namely fat, fiber, and protein, they promote fullness. Now, poor sleep can disrupt our gut hormone signals. Do you ever feel hungrier or crave certain types of foods on the day you've gotten little sleep? That's why. I always tell my patients if we don't recover all of our energy, charge all of our batteries at night like we're supposed to, the next day, our body's still going to want to recuperate that energy that it didn't at night. So where are we going to get energy? From food. What type of food is our body going to crave? It's not going to be a bag of carrots. That's for sure. So the last one here is outcomes. So why does all of this matter? The process of reaching satiation and satiety can ultimately impact aspects of health that are relevant to our Hispanic and Latino patients. So, blood glucose management, right? Weight management, feeling fuller longer can help reduce caloric intake or manage caloric intake at healthier levels, levels that don't promote weight gain or increase visceral fat. Interestingly, we see in the research that feeling full or reaching satiety doesn't always mean less food intake. It can help to improve also our relationship with food. Very important, right? More awareness of how you feel after eating certain foods, more understanding of how foods fuel you can empower you to make choices that bring joy, bring nourishment, and satisfaction. And maybe leave out those conversations of guilt, right? Repairing a relationship with food that may have been damaged by other factors, growing up, diet culture, et cetera, et cetera. Now, maintenance and enjoyment of healthy eating patterns. Of course, if you enjoy what you're eating, you're going to keep eating that. So that's a great outcome. All right, one more visual. This is an outline of the pathways involved in communication of satiation and satiety between the body and the brain. This is after food is eaten, digested, and absorbed. What precedes this and complements the process are the psychological factors, sensory experiences, our environment, memories, beliefs, etc. This process is complex and doesn't happen in an instant. Research actually suggests that it takes about 20 minutes for these signals to reach our brains, telling us that we're full. So, if we have a 30-minute lunch break and we scarf down our food in 10, we're going to get that post-Thanksgiving meal feeling, the one where we have to undo the top button, if we had that second helping of food. What happened is just that we didn't give those signals enough time to connect. So we thought we still needed a second portion of food. And this rushed eating can actually become a habit that goes beyond that 30-minute workplace lunch break and starts to seep into our home lives. So as a helpful tool, let's get patients to understand this concept. As we experience in the mindful eating exercise, slowing down, pausing helps to give our brain time to catch up. It brings more awareness to how we're feeling. It can help us to recognize our body's physical hunger cues. See if they're willing, your patients, to try a mindful moment. Breathing exercises before lunch, for example, to help them to slow down, to help them to be present and get them ready to savor every bite. Okay, so we know we can't control all of the complex pathways that impact satiation and satiety, but there are things that we can do to influence these pathways and the outcomes that relate to our satisfaction, our fullness, and long-term health. So number one, consuming an eating pattern that includes these key satiety-inducing nutrients. Here's where the balance of the plate comes in. Filling in every puzzle piece on the plate. Number two, consider timing of meals. So many of our patients have inconsistent eating patterns, and something as simple as setting up routine meal times or encouraging them to take 20 minutes to eat their lunch, it can make a world of difference. Emphasize lower energy density foods. Number three, plant-based eating patterns have an advantage here. And number four, engage in mindfulness. That practice of being fully engaged with the present moment without judgment. We're starting to see, right, that it can help to enhance our relationship with food and also help us to slow down, get more nutrients in, right? Give our brain that time to catch up with our body's signals. So certain nutrients are responsible for promoting satiety through different mechanisms. Think back to that plate I showed earlier. Fat, fiber, and protein all promote satiety by slowing digestion and stimulating those satiety hormones. Slower digestion leads to slower glucose absorption, and this is where blood glucose management comes in as a benefit of eating foods that fill us up. Pairing these nutrients at a meal can enhance satiety. Let's look at this dish on the screen, for example. The beans are providing protein and fiber, and the avocado are healthy unsaturated fat and a good source of fiber. So this is where we're thinking of food not just as a protein or a fat. This is where this helpful thinking can come in as well. Food as a package. Now, our plant-based protein sources come packed with those healthy, great pairs. Beans and lentils are rich in protein and fiber, right? Amongst other vitamins, minerals, phytonutrients. Tofu is a great source of protein and high in polyunsaturated fats. And our nuts and seeds, well, they have all three: helpful fats, proteins, and fiber. All the while, we keep telling patients to eat more of these in their eating patterns. Now, fat also enhances mouthfeel, palatability, and satisfaction of a meal. And this part, satisfaction, it's very important. This is what's going to make the difference between a dish I make again for my family and one I don't. So in terms of fats, we always want to make sure that our patients are diversifying their options. They're focusing on unsaturated fats, like those in avocado, nuts, and seeds, and they're limiting their daily intake of saturated fats. There's another webinar that I recorded on this very topic that you can find on loveonetoday.com. It's called Dietary Fats Decoded. Now, I know that there can be concerns about fats due to their energy density, or there's still confusion left over from the low-fat era from patients, for example. There's quite a bit of favorable evidence for plant-based diets rich in unsaturated fats and their impact on body weight, plus overall wellness. This study on the screen is one example. People ate an avocado a day for 6 months as part of their usual diet and didn't see a change in weight. There are other study references that are listed on the slide for you to check out if you're interested. Now, here's our study that demonstrates how fat and fiber can impact satiety and satisfaction. This was a randomized controlled trial done over breakfast where study participants ate 3 different meals on separate occasions. The meals had a similar number of calories, but varying levels of fat, fiber, and total carbs. So we had the control meal, which was lower in fat and higher in carbs. We had the control meal plus the half avocado in meal 2. We had the control meal plus a full avocado in meal 3. Now, the meals with avocado naturally had more fat, all those unsaturated healthy ones we talked about, and fiber, that the control meal. And since avocados are a source of these nutrients, these meals also had lower total carbs than the control. Now, all 3 meals significantly increased fullness and satisfaction and significantly decreased hunger, desire to eat, and how much food someone thought they could eat later in the day. However, the avocado meals with more fat and fiber offered additional benefits. Compared to the control, the meal with whole avocado decreased hunger significantly more. This meal had the greatest amount of fat and fiber. The avocado meals also had a greater effect on meal satisfaction and significantly decreased post-meal glycemic and insulinemic responses. And lastly, with regard to satiety hormones, GLP-1 and PYY reached peak concentrations more quickly, about 30 minutes after the whole avocado meal versus about an hour after the control. And the whole avocado meal had a greater exposure to GLP-1 6 hours after the meal. There was just more of it around for longer. Now, more research is needed to generalize the results to more people, but these findings add to the growing body of evidence connecting avocados and fat and fiber, right, that powerful combination, to a positive impact on satiety and satisfaction. Now, this is another randomized controlled trial that looked at the impact of beans versus beef on satiety in older adults. It was also an intervention over breakfast and set up similar to the avocado study we just talked about. There were 3 meals in which the fat, fiber, and protein varied. 2 types of beans, black and red kidney, and extra lean ground beef were used in the meals and incorporated into a breakfast tortilla bake. After all the meals, fullness and satisfaction were significantly increased, while hunger, desire to eat, and how much food someone thought they could eat later in the day were all significantly decreased. These results show that beans may improve satiety to an extent that beef does, which helps to show the value of plant proteins in the diet. Some evidence suggests that what's on the plate for the first meal of the day, breakfast, matters when it comes to satiety for the rest of the day. Findings from the Big Breakfast study suggest that a bigger breakfast has a greater impact on reducing hunger and appetite versus eating a bigger dinner. So having a larger meal at breakfast can have a greater impact on satiety throughout the day. So why does this matter? Well, we talked earlier about feelings of hunger at night and wanting to eat or snack, right? These are common and normal, but eating balanced meals throughout the day that keep us full and satisfied can help manage these late night cravings. Here's an example. I had a patient tell me that her breakfast consists of taking bites of food from the kids' breakfast she's serving while she's getting them ready for school. Then she comes back from walking them to school. She has to start making lunch and gets distracted doing housework. So she tastes the food as she prepares, but waits for the kids to come home from school to serve them and then have something to eat herself, right? Trying to get that family meal time in. So at night, when she's gotten everyone to bed, she gets this ansiedad para comer, right? These cravings for food, even after she's had her dinner. So what opportunities do we see here? Well, my intervention was, I heard her in the consult say, I was taking her, her food recall, that she likes yogurt and the kids like yogurt. So I deduced cold breakfast, okay? They're also used to eating avena, oats. So I asked them, would you be willing to try those cold with fruit in a parfait fashion, right? It's not a typical Latino breakfast, right? But since they liked all the elements, they tried it and they got to make it together the night before and they got to eat together the next morning because now there wasn't a lot of different pieces to put together. There was just pulling it out of the fridge, sitting down and eating it, right? So finding ways to help fill those core cultural needs, meals together, feeding the family, right? Showing love. Also, I'm a big fan of oats because they have the viscous fibers that contain beta-glucans, and we know that these can impact satiety directly. So whenever I get a chance to speak about oats, I do it. All right, energy density. Now, I'm sure that many of us are familiar with this concept of energy density from Barbara Rolls' research. Energy density is the number of calories per gram of food. Foods with high energy density, like the ones on the right, have a higher amount of calories for a small amount, and foods with low energy density, like the ones on the left, they have fewer calories for a large amount. Lower energy density foods appear to be more satiating than higher energy density foods. Lower density foods are also nutrient dense. And I like to think about the word dense as like packed, right? So there's packed with nutrients. Think fruits and vegetables like avocado, mango, tomatoes, peppers, beans, grains, tofu, right? And this is the plant-based advantage. Foods that are lower in energy density are high in nutrient density. Those vitamins, minerals, phytonutrients, fiber, water. So we get a lot of bang for our bucks when we include these on our plates. Más plantas, más salud. That's one to remember. Now, does this mean that we can't eat higher energy density foods? No, we rarely eat foods in isolation. So what matters for enhancing satiety is really building a balanced plate that emphasizes plant foods. The concept of energy density is so helpful for our patients to understand. And this is why in our programs, we have a whole class dedicated to the concept of calorie density and nutrient density. We like to use visuals like these as educational tools that help our patients really understand the choices they're making. Now, helping patients understand why we're recommending what we recommend is incredibly powerful. And the visuals really help them to see the whole package they're subbing when they make these swaps. So in this example, we have, what might be a traditional quick breakfast, café con leche, an evaporated milk with bread and butter, right? Or we have a latte with a concha, right? Traditional Mexican pastry. So what would be a recommendation instead? Here we have a tofu scrambled toast, right? Our whole grain bread. And we show them, right? Because we talk a lot about tofu in our programs as a great plant protein. And then we have some café con leche de soya or soy milk. And we show them the different density of calories in these two options, right? We can already start to see the more colorful variety at the bottom as well. And we let them know that you can even put another piece of toast and make it a sandwich. And so the volume is higher, the nutrient levels are higher, just in the colors they can tell, right? And you're going to be fuller longer. We asked them the question, which one is going to keep you fuller longer, right? We take it a step further and we look at nutrients like fiber, right? We look at added sugars and we look at the comparison between the package, that's what's coming in these choices of food and why we're making the recommendations that we're making. So the visuals really help to communicate, to convey these messages. And number 4, engaging in mindfulness. Now, mindful eating is a powerful research-backed practice that can help improve satiety, digestion, and your overall relationship with food, mind, and body. I mentioned earlier that I often hear Latino patients discuss that ansiedad para comer, that uncontrollable desire and anxiety to eat. Think back to my patient we just talked about with the bites of food at breakfast. Once we started implementing a higher energy nutrient breakfast, right, the ansiedad lessened some. But why? As we've seen, it isn't just as simple as put breakfast back in and the nighttime cravings will lessen. The ansiedad para comer isn't only about skipping or skimping on a meal. Those psychological factors we discussed can also be involved in satisfaction and satiety. Now, for our population in particular, the ansiedad can come from the immigration part of the story and unique cultural factors like familismo and mental health stigma that we mentioned earlier. With familismo, this strong commitment towards the collective, la familia, over the individual can sometimes come at a cost to individual health. So if you've ever seen the movie Encanto, you know this is well exemplified in the character of Luisa. In fact, if you want to see a really a portrayal that's so well done of the dynamics and the roles of the Latino family, right? This one is based in Colombia. Watch Encanto because it does such a good job of showing this. Now, in the film, the character Luisa is the one that is she's depicted or drawn as strong, right? And she carries all of the family's burdens because she's physically strong, but it also, we can see that it's taking a toll on her mental health. But she has to pretend like nothing is wrong, and she's strong enough to carry all of this stuff because that's what's expected of her. That is her role in the family. So, and other characters are explored with similar roles, but particularly when we're thinking about that and the collective over the individual, Luisa has to put on a happy face and do everything she can for the family. Now, in my experience leading classes over the years, I've seen a lot of women who are so used to being everything for everyone that they just forget to take care of themselves. They forget how to, and they put themselves last. But in this hour-long group classes that we hold in our programs, I've also seen a lot of women find freedom in giving themselves this hour in class to have community, to grow, to help themselves, to be empowered in the decisions that they make for their own health. So in the 10 years that I've been teaching group classes or facilitating group classes with the Hispanic and Latino community, I've never heard a patient share anything about their own mental health. And just a couple of weeks back, when we were finishing the class, a patient of ours, as she was thanking myself and the other instructor, mentioned in class, I'm going to start seeing a therapist because I discovered in this mindful eating class that I have these issues with food and I want to discover where they come from. And she's like, I'm just really excited to start working with this therapist and take that on. And I'm telling you, I was floored by this share because, like I said, I've never heard anybody in the Hispanic Latino community for as many years as I've served them be open about this. So I'm hoping that this is something that, as we introduce these concepts, these powerful tools of mindfulness and mindful eating, um, we can continue to open up worlds for people, right? It's one of the many reasons that I love engaging in mindful eating strategies with this population. It's a simple yet powerful tool. So perhaps we can consider that helping my patient put breakfast in helped her reduce the stress of the morning rush. It helped her just sit down and enjoy a mealtime moment with her kids, which probably contributed to reducing the ansiedad para comer at night just as much as the act of physically adding the meal back in did. All right, so with this conversation in mind, let's put things into action. Now, back to the plant-powered plate that we use in my program. Not only is this a guide to colorful, balanced meals that promote health, it's also a guide for meals that are satisfying and will help enhance satiety. So as we can see, a quarter of the plate is broken up into plant protein, color-coded purple for protein. Whole grain starchy vegetables is the yellow here, quarter of the plate. Non-starchy vegetables, green, half the plate, right? And then we have that dot in the middle is going to be our healthy fats that bring it all together. So when making recommendations to add more plant proteins, etc., to dishes of Hispanic, Latino populations, let's remember, cherish traditional dishes, often centered on meat, dairy, and animal fats. So shifting away from using meat can sometimes be perceived as a rejection of one's cultural identity. Consider family and social pressures that a patient can go through. Patients opting for a plant-based eating pattern may face a lot of teasing and misunderstanding from family, which can make family gatherings quite challenging. And there's always lots of family gatherings. Now, of course, I say this from experience because I myself have been subject to this, but it's fine because there are ways to meet in the middle and identify changes that work for the individual. So here is where a concept like think addition versus subtraction can come in. What legumes, veggies go well here in this dish and with this recipe? What can be added to the plate? Adding more of these plant foods can help crowd out less health promoting foods, right? Think addition, not subtraction. Here's also where listening first, being curiously engaged in the culture will go a long way before making recommendations for substitutions. So we want to be sensitive that changing eating habits can be an emotional journey, right? We're not just asking our patients to change eating habits routines. We're essentially asking them to rethink part of their identity. Just really want to drive that message home of how tied we are to our foods, right? Again, we fly them like the flags of our country, okay? So in the concept of culturally aware substitutions, Here's an example of a plant-powered meal. Here's a tofu scramble. Okay. So we know that the tofu is going to give us the plant protein. The corn tortilla is the whole grain. The avocados are the healthy fats. And then we have all the colorful veggies, non-starchy vegetables, a lot of fiber, right? And, oops, sorry, but let me go back to that. So we'll see on the bottom right here, on the bottom left-hand side, we have nopales, okay? Nopales is a prickly pear cactus, similar in texture to okra if you've never had it. It's found regionally in the southwest parts of the US and in Mexico. Now, nopales con huevos is a traditional Mexican breakfast staple. Nopales with eggs, right? Served on a corn tortilla. And so here we're introducing two ingredients, tofu and nutritional yeast, but the rest are familiar ingredients. Okay, so how do we introduce this when we're trying to introduce a new ingredient? One, we want to pair it with many familiar ingredients. When we're introducing a plant protein like tofu, we want to demystify tofu for patients, right? I tell them it's made in a similar fashion to cheese, to dairy cheese, but from soy milk. What's cool about this one, though, is that you can make it taste like anything you want. It's like a sponge for flavors. You know, all the species, all the marinades that we're going to put into it, it'll soak them right up, right? You can put it in a pan after of course, you have to tell them to press the water out. That's key. But you can scramble it in a pan and it cooks quickly, just like eggs, right? You're going to saute it, you're going to season it, then you're going to saute the veggies just like you normally would for your breakfast, right? And top it with creamy avocado slices or make some guacamole on top. And so that is one of the ways that we could introduce it with familiar ingredients. Here's what I was looking for. Okay, so when we show slides like these, we also make sure that all of the items are matching the colors on the plate. And we do a lot of repetition around this so that people get to know which is which, right? We have the greens, again, for non-starchy vegetable. We have the purple for protein. The carbohydrates are in yellow, right? And then our healthy fats, like the avocado, that tops it all, is going to be in orange. So avocados are one of my go-to healthy fats for many reasons. Epidemiological research in Hispanic and Latino populations have shown an association between avocado consumption and lower risk of diabetes, better glycemic responses, and improved diet quality. As culturally traditional food, it's just such an easy add that can help be a pathway to healthy eating. An easy add, an easy sub, right? For other less healthy fats. Okay, here's another example. The tofu scramble on a whole wheat toast with a side of arugula. So this definitely doesn't look like a traditional breakfast in a Latino household. But in New York, where I practice, if I could go down the street and get a box of arugula for $1 at a green cart, right? Or at Mr. Piña's corner store, even if arugula is not part of a traditional Mexican cuisine, you better believe I'm going to be teaching my patients how to use it. If it's nutrient dense, it's affordable, seasonal, regionally available, I'm going to be asking questions like, hey, have you seen that they sell this box of leafy greens called arugula for $1 at Mr. Piña? Have you ever tried it? Do you want to know how I use it? Do you want to know how to use it? Right? Now, my culinary training chef mind takes me to the idea of fusions as well. So the most famous restaurant in Peru right now, the #1 in the world restaurant, not to brag, but yes, is called Maido. That's a Japanese Peruvian fusion restaurant. Japanese people came to Peru. They saw what was available. They learned to work with new ingredients while still keeping, of course, some of their cherished traditional methods and flavors. And they created a fusion. And Maido is as Peruvian as the potato. So fusion is a great context from which we can work from and feel okay with suggesting ingredients while being mindful and respectful of cultural food waste. Here's my little color assignments to all of our ingredients, again, for repetition. Okay, last example of something that we use in our programs, a tool that maybe you can create for yourselves as well. We have these vegetable fruit boxes, and patients enrolled in other similar food as medicine programs, might receive produce boxes, but they might be unsure how to use the produce, right? So we want to make sure that we're bridging the gap with unfamiliar ingredients culturally. When I was back in graduate school, we had a program in San Bernardino for a food pantry. And San Bernardino is a high Mexican population that is served at the food pantry. But there was a Chinese grocer, for example, that would donate boxes and boxes of bok choy. These would be left untouched because bok choy is not part of a traditional Mexican culinary tradition, right? Not sure how to use it, not sure what to do with it. So how do we bridge that gap? That is so, so, so important anytime we're doing any intervention like this. So our tool that we use, of course, has to come back to the plate and our colors. So for example, in this recipe, we're highlighting sunchoke, which is not a familiar ingredient in Latino culture at all. And we have this sunchoke leek soup. And what we do here is, this is created by our dietitians in our program, and we have what's included in this recipe according to the plate. So we have, for example, the sunchokes that are going to be a starchy vegetable, and we have non-starchy vegetables in this recipe. We also have a place for what's missing in the recipe, right? And we can see that there's going to be some protein and healthful fats that are missing. Then we're going to make sure that the recipe also includes suggestions for what to add to make this a complete, balanced, plant-powered meal, right? So we're going to just suggest for the proteins, for example, some chickpeas and avocado or olive oil for healthy fats. Now, when working with the Hispanic Latino population, it's awesome to have 2-3 go-to recipes to share. That can be really helpful. Something that you've made, preferably, because you know it's going to be good, right? Remember, we love food, we love something flavorful, and we love if you made it too, right? Because then you can talk us through it. We love talking about recipes. Now, patients usually will not be intimidated by a recipe with too many ingredients either. So here you also, though, want to be mindful that there is a common belief that fresh is best. And so your patients may be used to cooking fresh food every day. And a lot don't believe in leftovers, especially like in my grandma and my mom's generations. They feel like food loses nutrient value if it's frozen. But most importantly, that it doesn't taste the same after a couple of days. So it loses flavor. But remember, we're big on flavor. So these are all good opportunities to dispel any misconceptions and normalize the benefits of freezing foods. It's going to save, prep time, money. It's going to be better for the environment because less food waste, right? So great opportunities to normalize benefits of frozen and canned fruits packed in water and vegetables, which can also be more affordable than fresh produce at times. All right, a last word about mindful eating and practice. If you are new to the practice of mindful eating and you want to help your patients get exposed, start with the practice, you'll find some wonderful resources on loveonetoday.com. This handout here is going to list tips to put mindful eating into practice. And you'll also find wonderful recipes in English and Espanol on there that you can share with your patients and even ones to make yourselves. Remember, I encourage everybody to get in the kitchen. There's nothing like being able to walk a patient through a recipe that you've tried out. Now, on the right-hand side, the mindful eating plate. One of the things that I love about Dr. Albert's mindful eating plate is that one, it's a plate. We can see how much we love these. But I also love how you can take a patient around the plate, right? You start with the green in the moment spot. You finish with the all-important non-judgment piece, right? This is the place where we give ourselves permission to take morality out of the eating conversation. where we can acknowledge that there is no me porté mal or me porté bien hoy, or I was good or bad based on the choices that I made for the food to eat today. And there's a lot of freedom from guilt associated with food choices to be discovered here. So I'm going to finish off with some counseling tips that I've just accumulated in my practice throughout the years. Number one, make 1 minute feel like an hour. What I mean by this is practice the art of listening. Make 1 minute feel like an hour. There's really no substitute, I've learned, for the impact that you can have on a patient who feels heard and understood. And my biggest piece of advice is to take that minute. No typing on the computer, no other notes. If you start getting into your head about what's the right way to respond, gently put yourself back into listening of what the patient is sharing. Remember, the patient is the expert in their own lives. They're going to steer us in the direction where we need to go. We need to trust ourselves that we will know where to go next. That's the other piece. If you listen first, you're starting to create that safe space for patients and building that strong relationship right from the start. And with this population in particular, once you create that safe space and we trust you, you're familia. Bonus points if you're making an attempt to learn and say a few words in Spanish. We love that. Number two, if you didn't have time to do a little research about common foods in your patient's country of origin, get to know your patients and their dietary habits by asking lifestyle questions. Ask and listen carefully. Who does the grocery shopping or cooking in your household? What are your favorite meals to eat or make? How often do you share meals with your family? Help identify realistic goals. Remember, descriptive versus prescriptive. If you've established that a patient is ready to make changes, establish an action plan together, even one small action plan, right? Set yourself a reminder to follow up on this action plan. That's follow-up, of course, is crucial for accountability. Some of the questions that we use to help patients create an action plan for the week are, what are you going to do? How much of it are you going to do? When during the week are you going to do it? And helping them to be as specific as possible helps them to put it in their calendar to really have a better chance of meeting that action plan. And number four, get the whole family on board. Patients' families, it's a common barrier that we mentioned earlier. They don't want to eat the same way that they're being recommended to eat. So we want to consider the cultural implications here again. Data gathered from the 2020 US Census showed that family dinner routines are more common in Hispanic and immigrant families, with 90% of Hispanic parents sharing frequent meals with their kids. So we have to help patients come up with strategies to engage the family because it's also so important for them. Something as simple as a suggestion to a patient of that overnight oats bars with her kids helped her to have that family mealtime moment. So helping patients finding creative new ways to use food that is cherished, food that is already a part of their routines. If you love pan con mantequilla, that bread and butter with cafecito, coffee in the morning, trade it for pan con palta, avocado, and cafecito with soy milk or black, right? Eventually. These are easy swaps that can be easily implemented with foods that people already eat. And of course, if you have an option to partner with, refer to a registered dietitian, because this is all the work that we do, and we want to help you do it. So my key takeaways are pride and preference drives sustainable nutrition and trust. Pride in our foods and preference for those foods, when providers really understand this and build recommendations around traditional or preferred foods, it really helps to promote eating patterns that are actually sustainable in the long term and builds trust between the provider and the patient. Number two, you want to lean into traditional foods that are nutrient dense and that patients may already enjoy. Could be avocado, beans, nopales. These can be the bridges to healthy eating Helping patients to get more of these at meals and snacks can help increase their overall diet quality and create foundational habits for healthy eating. A balanced plate, make sure that we're getting important nutrients, and it helps to promote satiety and satisfaction. Protein is in the spotlight now and maybe always. It's in the media, it's in new products, but it's not the only thing that keeps us full. Remember the two F's, fat and fiber, right? These are key also, that powerful partnership, that combination. And of course, mindful eating is just a powerful tool for connection and behavior change. And lastly, listen first, ask, and guide second. If you want to know more about avocados, for example, simple tips for you, for your patients, how to pick and store, you can find this resource on Love One Today, this and other resources on loveonetoday.com. Thank you so much for being with me today. And thank you, Love One Today, for your partnership and having me present this wonderful topic.